Alright, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. So today we are going to learn about the non-communicable disease, epidemiology and prevention, chapter 8 in BPS 2343. So non-communicable disease, it is mainly about the disease which cannot be transmitted from one person to another person. Okay, so I guess today we are going to learn about in detail about the disease, what type of the disease, and example of the diseases, and then the prevention and so on. Okay, all right. Okay, so for this chapter, the subchapters will be the scope of prevention, primary prevention, secondary prevention, tertiary prevention, and screening. Okay, everyone can hear, boleh dengar before I proceed? Okay, Alhamdulillah. Alright. So the learning outcomes we will, inshallah, can define and identify non-communicable disease, to distinguish between primary, secondary, and tertiary prevention, to describe the important feature of a screening test, to define and calculate sensitivity. Ni tak ada, yang last ni. Okay. So what is non-communicable disease? Okay, from the word non-communicable disease, okay, it means that the disease cannot be communicate between each other lah, between from one person to another person, okay, or from one host to another host. Okay, it cannot be transmitted. Also known as a chronic diseases are not passed from person to person. They are of long duration and generally slow progression. Always chronic in nature. Means chronic, that means it takes longer time to heal or for the treatment. Okay, no international definition of chronic disease actually. So permanent, extended over a period of time, non-reversible, and residual disability. So basically the characteristic of NCD, non-communicable disease, is as written here lah. Okay, so in non-communicable disease, actually we do not know what the agent actually. Okay, absence of a known agent, okay, which can cause the disease itself, and usually it is a multi-factor causation. Means that for example, in a lung cancer, the factors will be such as like smoking, risk factor, and then old age, male, and then maybe a genetic history and so on. Okay, so and it is a very long latent period. Okay, means that the symptoms and signs will appear after it takes time, long period, and then indefinite onset as well. Okay, so anyone can tell me what give me one example of the non-communicable disease I know. Okay, anyone boleh tak bagi tahu saya satu contoh? Diabetes. Okay, diabetes mellitus. Okay, Amir Najib, give me one example. Amir ada? Amir Najib Kamil. Okay, give one example of non-communicable disease. Berdasarkan characters ni yang kita first slide ni, apa yang you rasa give me one type of disease. Yang contoh tadi Haris dah bagi tahu, diabetic. Another one? Lah cancer saya dah bagi tahu dah tadi. Another one? Ada lagi? Apa? Penyakit yang biasa kita panggil 3 serangkai selalunya kat orang-orang tua. Obesity kan. So obesity kita tak tahu dia punya agent dia, causative agent dia dan sebagainya. Okay, that is one example lah. Okay, thanks Najib. Amin. Alright. Okay, so global trend of NCD. Okay, NCD kill 41 million people each year, equivalent to 71% of all deaths globally. Okay, each year 15 million people die from NCD. Okay, selalunya umur 30 hingga 69 tahun, means that the NCD, yes, it is very common among old age, but currently in young adult also, okay, can have this non-communicable disease as well. Okay, cardiovascular disease, one type of NCD, account for most NCD death, sakit jantung, okay, followed by cancers, respiratory disease such as COPD, chronic obstructive pulmonary disease, due to heavy smokers, and diabetes. These four groups of disease account for over 80% of all premature NCD death. Okay, tobacco use, physical inactivity, harmful use of alcohol, unhealthy diets all increase the risk of dying from NCD. So all of these are examples of multifactorial which can lead to the NCD. Detection, screening, and treatment of NCD as well as palliative care are key components of the response to NCD. And that's why we can see the screening, the detection, and treatment of NCD have been done in klinik kesihatan, hospital, to trace, okay, people who develop this disease and take action lah, atau prevention from the disease becomes complicated lah, complications such as diabetic retinopathy, atau renal failure dan sebagainya. Alright, so who is at risk of NCD? Siapakah yang berisiko untuk mendapat NCD? People all of age groups such as I have mentioned before. Okay, this condition are often associated with all the age groups, but evidence show that 15 million of all mortality attributed to NCDs occur between age of 30 to 69 years old. Of these premature deaths, over 80% are estimated to occur in low and middle income countries. Maybe because the health facilities are not good there. Okay, the service are not excellent. So the prevention and also the screening and the treatment also is as not it's not same as the high income countries. The risk factors contributing to NCDs are unhealthy diets, physical inactivity, exposure to tobacco smoke, or the harmful use of alcohol. Right. So this graph shows us the prevalence of NCDs, okay, in comparison to injuries and communicable disease, and we can see that non-communicable disease take majority, what we call the prevalence of total death, okay, and that's why it is a problem that needs to be tackled in terms of prevention and screening, treatment, and so on. Okay, age standardized rate for all ages in low and middle income countries. Okay, this showed us regarding the number of death rate among NCD, and 65% and 85% higher respectively than for males and females in high income countries. Age standardized mortality rate for all ages were highest in the African region for males, and for females inilah 9724. Okay, why African region? Because most of them are included in the middle and low income countries. Okay, so from this statistic, it showed us about causes of morbidity and mortality. Okay, and we can see that 5 leading causes of morbidity and mortality in Malaysia in 2002, and also and part of them is caused by the NCD, such as in cerebrovascular disease, malignant neoplasm, okay, disease of circulatory system, respiratory. Alright, so all of these are caused as by the NCD lah, non-communicable disease. Okay, normal delivery as well, normally is not a disease. Okay, alright. So risk factors of NCD, okay, aging, alright. When we become older, okay, we are risk to get the NCD as well. Rapid unplanned urbanization, the globalization of unhealthy lifestyle, okay, like currently, globally, a very unhealthy lifestyle involve many I mean different kind of ages, okay, people uh, in every country, especially such as in COVID-19 pandemic currently, where we are not permitted to go outside, okay, the unhealthy lifestyle also increases as well. So this will lead to raised blood pressure, increased blood glucose, elevated blood lipids, overweight and obesity, okay, which then can lead to the disease such as NCD, non-communicable disease such as diabetes mellitus, hypertension, all right, obesity, and so on. Okay, obesity is not the disease, but it is one of the risk factors which can cause uh, the NCD lah. Okay, so risk factors of NCD, okay, basically we can divide it into two. The factors can be divided into two, which are the non-modifiable and modifiable. Non-modifiable means that we cannot modify it. Okay, it is the factors are actually uh, within us. Okay, and we cannot modify it. So basically, these factors we have to accept it. All right, such as in age, sex, family history, genetic factors, and personality. But usually, these factors are not contributing so much to the development of the disease. Okay, in comparison to the modifiable risk factors, okay, which are the factors that we can modify, means that we can modify it so that you can prevent it from developing the disease lah. Okay, such as we take a very good diet, okay, no cigarette smoking, okay, and control our blood pressure, can control our cholesterol, okay, our body weight, which can be either diabetes, obesity, our glucose in our blood, our habit, active lifestyle, okay. So all of this can be modified, means that we can take action, okay, on these factors so that we can prevent from the NCD and non-communicable disease. So modifiable, okay, we go first to modifiable behavior risk factor, okay, such as tobacco, accounts for almost 6 million deaths every year, including over 600,000 deaths from exposure to second-hand smoke, or we call it as a passive smoker, and it's projected to increase to 8 million by 2030. Okay, so smokers have a higher risk of getting the NCD in comparison to the non-smoker as well. So insufficient physical activity, okay, low fruit and vegetable, okay, unhealthy diet, and dietary habit, okay, it shows us from 1960s to late 1990s, steady increase in the proportion of calories from animal sources from 105 to 20%, steady decline in calories, and proportion of protein from animal sources increased from 30% to 60%. That means our dietary habit actually becomes worse from time to time due to the uh, processed food, okay, uh, fast food company, okay, and all of these actually contribute, leading to the risk to be a risk factors for NCD lah, non-communicable disease. So the behaviors lead to four key metabolic psychological changes that increase the risk of NCD, raised blood pressure, overweight, obesity, hyperglycemia. Hyperglycemia leads to diabetes. Hyperlipidemia can lead to the cerebrovascular disease, ischemic heart disease, okay, which can cause plaque inside our blood vessel, okay, and then this will narrow the blood vessel diameter, okay, and then can lead to the hypertension can lead to the stroke, and so on. Okay, so we can see that not only stroke, but also this also can lead to other disease as well, okay, such as ischemic heart disease, okay, and then like hyperglycemia diabetes can cause diabetic retinopathy, we can be blind, okay, due to accumulation of the metabolic glucose inside our eye anatomy structure, okay, and then also can lead to the renal failure as well, okay, due to the damage to the our renal function. So low and middle income countries are witnessing the fastest rise in overweight young children. Okay, not only in the high income countries, but currently low and middle income countries also when it's in the faster rise in overweight, unhealthy diet, and so on. In terms of attributable deaths globally, we can see elevated blood pressure currently take the number one position for 16.5%, and then followed by tobacco use, raised blood glucose, physical inactivity, and overweight and obesity. Okay, so this uh, figure showed us uh, the management, okay, or what factors actually can lead to the health outcomes, means the mortality and morbidity, the quality and length of life among the population. All right, so these are actually contributed by the health factors, okay, such as in health behaviors, okay, risk factors which we have discussed before, and then clinical care, okay, social and economic factors, okay, which can also contribute to the health behaviors as well, okay, and physical environment and water quality and housing and transit. So it is very important that the policies and programs can tackle, okay, all of these health factors, okay, so that we can get better health outcomes, which at the end of the day can increase the length of life and quality of life. So it is very important to know what are these factors contribute uh, to the NCD, and then the policies and programs can be managed, okay, can be arranged so that these health factors can be tackled, and then the health outcomes can be increased lah in terms of length of life and the quality of life. Okay, so we go to the very common NCD, which is the diabetes. Okay, about 3.7 million people worldwide have diabetes that can be traced back to rapid increase in overweight, obese, and physical inactivity. Diabetes is predicted to become the seventh leading cause of death in the world by the year 2030, where have risen to 552 million. Total death from diabetes are projected to rise by more than 50% in the next 10 years. 80% of people with diabetes live in low and middle income countries. Okay, so it is not what we call a disease of rich people, but currently also it involves all group of people in terms of the socio-economic status. So diabetes can be divided into two types, type 1 and type 2. Type 1 due to lack of insulin production, and type 2 the ineffective use of insulin resistant. Alright, so basically, diabetes inside our body, diabetes is very much related to the insulin hormone. Okay, insulin hormone is responsible to take the blood glucose inside our blood. Okay, okay. Imagine this is our blood vessel, right, and this is our tissue. Okay, so uh, this is okay, so this is a glucose. Okay, alright, gula lah, gula dalam darah and this is tissue, okay, blood vessel, this is a glucose. So you need to bring this glucose inside the tissue for the metabolism, okay, nutrient lah, for the ATP production and so on. So you need glucose in many forms lah. Kita ada apa nama dia, banyak-banyak lah. Alright, and then so to transport this glucose inside the tissue, okay, you need a transporter. Okay, so a transporter, or we call it which can bring this glucose to this tissue, is what we call as a insulin lah. Okay, insulin will attach this glucose, okay, and then it can bind to its receptor here, and then can bring this glucose to the tissue. Okay, this is a general idea lah about the function of insulin. Alright, okay, so in type 1, okay, there will be insufficient of insulin production. Okay, so this insulin is not here. Okay, there is a very little or minimal amount of insulin, okay, in type 1. Okay, insulin is produced by, okay, siapa tahu insulin dihasilkan oleh which organ? Ya, betul. Pancreas kan. Okay, so usually type 1 is a genetic factor lah ataupun commonly occurred among young people. Okay, because there is some what we call incompetency function in the pancreas inside the human body. Okay, and they cannot produce sufficient insulin, which is responsible to bring the glucose to the from the blood vessel to the tissue. Okay, so that is a type 1, which is very common among young people. But what we are seeing right now, okay, the diabetes, which is very common, is a type 2 diabetes. Okay, due to ineffective use of insulin resistance. There is insulin here, okay, but the insulin cannot function very well due to the insufficiency of the receptor itself, or the receptor. Okay, there is a receptor here for each insulin. Okay, receptor which can where the insulin can attach. Okay, either the insulin resistance means that it cannot attach to the receptor, or the receptor is cannot function very well. Okay, so the function of the insulin is impaired. Okay, there is insulin, but the insulin cannot be used properly. Okay, that is a type 2 diabetes. Okay, so basically what we will do in type 2 diabetes, okay, for those who have an insulin injection, okay, we use another like artificial insulin, okay, to promote this glucose uh, transportation from the blood vessel to the our body tissue. Okay, so that's the difference between type 1 and type 2 insulin. All right. Okay, so diabetes, the greatest number of people with diabetes are between 40 to 59 years of age. Okay, 183 million people diabetes are undiagnosed. Okay, maybe some of us have diabetes, but we do not know because we do not have a medical checkup annually, or maybe the symptoms and signs of the diabetes are not prominent yet, so that's why we cannot. So to diagnose the diabetes, actually you have to do a blood test, okay, to see your glucose level inside your blood. Diabetes is the leading cause of blindness, can cause a diabetic retinopathy, amputation, okay, and kidney failure lah, okay, such as I have mentioned before. Alright. So next, NCDs, which is very common, we call it as a hypertension. Okay, hypertension, increase in the blood pressure. Okay, so normally blood pressure, when we want to measure the blood pressure, there are two, we call it two numbers that we want to measure. The first one, the upper number, we call it as a systolic pressure, and the lower number is the diastolic pressure. Okay, so the upper number, okay, the normal one should be less than 120, and the diastolic should be less than 80. Okay, we call it elevated blood pressure when the 120 to 129 in systolic and less than 80 in diastolic. Hypertension, okay, we can diagnose it as a hypertension stage 1 if the systolic becomes 130 to 139, or diastolic 80 to 89, stage 2, 140 or higher in systolic, 90 or higher in diastolic, and crisis higher than 180 in systolic, and diastolic higher than 120. The problem among our community is that we do not know either we have a hypertension or not, and we do not know if we do have hypertension, we do not know which stage we are in currently. Okay, the stage is very important to know, because if you are in this hypertensive crisis, it can occur very acute episode or acute onset, means that it can cause the complication without you realize it. Okay, such as in stroke people, okay, they do not know, most of them do not know that they actually had blood pressure, but all of a sudden, okay, they develop stroke, because when we measure the blood pressure inside their body, it is actually in this stage lah. The systolic have become more than 180 and the diastolic higher than 120. So the management usually, okay, this person will be brought to the ED emergency department, and we will had anti-blood pressure drugs or treatments which have to be inserted by injection, where we want to have a very acute rapid response, okay, to slow to lower down the blood pressure among the people who get the stroke lah. Okay, so it's very important to know the hypertension, because if we are in this stage, we can control it, okay, before it develop to the severe or very dangerous stage, which is in a hypertensive crisis. Okay. Smoking, alright, smoking is not a disease but risk factor which can lead to many NCD lah. Okay, smoking is the inhalation of the smoke of burning tobacco encased in cigarette pouch and cigar. A smoking habit is a physical addiction. Okay, it's an addiction, so it's very not easy to be what we call eliminated. Okay, and also can be rated as a psychological addiction. Passive smoker or passive smoking is the inhalation of smoke called a second-hand smoke or environmental tobacco smoke from tobacco products used by others. And studies have shown that passive smoker also can get the same complication, and some of them even can get more or severe, okay, or much worse, all right, disease complication in comparison to the active smoker. So if your family members or if yourself, okay, do smoke, I do really hope that you can stop it, okay, because it is not too late. If because it is just not and it doesn't then endanger yourself, but also it can endanger your family members as well. Okay, and unfortunately your family members will get the much more complication, okay, in comparison to yourself. Okay, tobacco products are defined as products entirely or partly made of the leaf tobacco as the raw material which are manufactured to be used for smoking, sucking, chewing, or snuffing, okay, based on the WHO Framework Convention. Alright, if we look here in this figure, risk for smoking, okay, it can cause chronic diseases and cancer. And cancer, it can cause cancer from top to bottom, okay, from above to down below here, from head or neck to the reproductive system, okay. And from the chronic diseases as well, it can cause stroke, blindness, gum infection, aortic rupture, heart disease, pneumonia, hardening of the arteries, and chronic lung disease and asthma, reduced fertility and hip fracture. Okay, not only mainly it can will cause the NCD, non-communicable disease, and also lung cancer as well. Lung cancer is also part of the NCD. Right, smoking preventive and control measures. Okay, these are action measures taken by different government body, and such as Malaysian government commitment to WHO Framework Convention on Tobacco Control, okay, Malaysia ratification and power, okay. So these actions can be taken, okay, such as monitor tobacco use and prevention policies, protect people from tobacco smoke, offer help to quit tobacco use. And for your information, the klinik kesihatan, okay, all around Malaysia, okay, had what we call a program, free program to offer help to quit tobacco use. Even they will give you some like nicotine replacement drug, okay, which can be used to reduce the addiction to the smoking. Okay, so it is we call it a free program, okay, and for the active smokers are encouraged lah to participate in the program to 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 uh, to to quit, okay, the smoking habit. Right, one about the dangers of tobacco: enforce bans on tobacco advertising, promotion and sponsorship, raise taxes on tobacco. So these are the control measures have been done to control and prevent smoking. Okay, right. The third NCD that we want to talk about is cancer. Okay, so cancer in Malaysia, okay, A research by Institute of Oncology, Radiotherapy and Nuclear Medicine in Kuala Lumpur Hospital has found that the incidence of lung cancer is increasing rapidly at the rate of 70% per year. It is a very large number. Okay, means that the cancer is prevalence, the cancer prevalence increase year by year in Malaysia. And the top 5 cancer we've got here is a breast cancer among females. Okay, but males also can get breast cancer as well, for your information. Colorectal, it is a very common cancer among male. Okay, for your information, colorectal cancer is mainly due to the processed food that we uh, actually eat, okay, in our daily life. Okay, those are the big factors which contribute to the colorectal cancer lah. Lung cancer among smokers, okay, cervical cancer, breast and cervical cancer usually occur among females. um, there are many risk factors contribute to the cancer, but most of them, okay, that I have encountered before when I became a medical doctor. Okay, uh, first one is the late of marriage. Okay, number two is because because of the late of marriage, then which can lead to the kita kata lack of pregnancy lah, kan, you tak boleh pregnant lah. Okay, basically when you are married and you are pregnant, okay, there is a hormone, we call it as a progesterone. Okay, but if you are not pregnant, the progesterone is not there lah, and then progesterone, the what we call the long exposure to estrogen. Estrogen is the hormone that you usually encounter every cycle of period, okay, among the females. This long exposure to the what we call estrogen hormone can lead to the breast and cervical cancer. So basically, if someone, okay, or females who are not married, and do not get pregnant, so usually they can have these two. There are risk lah, to have this breast and cervical cancer. Okay, that's why we can see our ancestors, our mothers, grandmothers. Okay, uh, very rare to get this cancer. Okay, and currently it's very common among female lah, right? And then we got nasopharyngeal cancer. Okay, also caused by smoking lah, mainly. All right. Okay, prevention. What is prevention? Prevention is actions aimed at eradicating, eliminating, or minimizing the impact of disease and disability. Concept prevention is best defined in the context of levels traditionally called primary, secondary, and tertiary prevention. So we can divide it into primary, secondary, and tertiary prevention. In simpler words, prevention is inhibiting the development of a disease before it occurs, interrupting or slowing the progression of the disease. Okay, why prevention? Why prevention is very important. The dramatic increase in life expectancy observed in the past century can be attributed primarily to improved preventive practices, not to advances in clinical medicine. So, we will live for longer because not of the advances in clinical medicine. Yes, it contributes a little, but primarily it is due to the improved preventive practices. Okay. Um, in Arabic they call it as al-wiqaya khairun min al-ilaj. Min al-ilaj means that prevention is better than cure. So it is there are, I mean, the advantages of prevention is much more in comparison to the treatment. Okay, in terms of the medicinal cost, okay, and then the severity of the disease, the complication, and so on. So it is very important, to have a preventive measures, okay, in the health policies and programs, especially in the government, okay, because this will contribute to the increase in life expectancy. Okay, all right. So life expectancy it bursts in Malaysia, so we can see the life expectancy becomes higher. All right, uh, in both male and female from year to year. Okay, due to the very effective health policies and programs, okay, that we have managed. and also effective in advanced clinical medicine as well. So level of protection, okay, what's the difference between primary, secondary, and tertiary prevention? So this is very important subchapter in this topic. Okay, so please pay attention. Primary prevention is the prevention of the development of the disease, means that the disease is not there yet. Able to reduce the incidence of the disease. Okay, the action measures that we can take, such as in general health promotions, specific protective measures, and healthy lifestyle campaign. While the secondary prevention is the early detection and prompt treatment of people with disease. Yes, the disease is there, but we can detect it early. Okay, so early detection, how we want to have or to detect early is through the screening program. Okay, screening program can increase the prevalence of the disease. Normally, to control chronic disease or can also be used in infectious disease such as pulmonary TB. To cure the disease, to slow the progression, prevent complication, to limit disability, to reverse communicability of infectious disease. And the last one is what we call as tertiary prevention. Okay, disability limitation and rehabilitation when disease already occurred and left residual damage. Okay, so this is at the what we call in the peak stage, but we want to prevent it, okay, before from become complicated, eh? Or for those who have a disabled person, we want to do the rehabilitation. Okay, basically secondary we want to detect early, okay, among the people. So in early stage we can take preventive action. For example, in the hypertension, I have mentioned before, we have discussed before that it got what we call the primary, secondary, tertiary, okay, stage, okay, first stage, second stage, third stage. All right, so if we do the secondary protection prevention, okay, we can detect, for example, the first stage, so it can be treated earlier and prevent it from become the hypertensive crisis, which can lead then to the stroke and so on. So it is very important to know the differences between primary, secondary, and tertiary prevention and what action measures can be done. Okay, so the question maybe come up with dengue disease or lung cancer and so on. So if you know the meaning of the primary, secondary, tertiary, the definition, and also you can know lah the action measures can be taken, okay, to prevent the disease, to control the disease. Okay, screening for disease in the community. So we are focusing on the secondary prevention, okay, which is a screening process. Screening is an early detection of disease, precursors to disease, or susceptibility to disease in individuals who do not show any signs of the disease. Okay, the disease is there, but the symptoms and signs may be or may be not there. Okay, so the screening pathway, okay, this is a screening program took part, okay, healthy people, disease or precursors detectable, okay, they have a disease but the symptoms haven't developed yet, okay, so that's why the screening program is very important before the symptoms develop. Means sometimes some diseases, when the symptoms develop, it's already in the stage 3 and 4, such as cancer, okay, even hypertension, diabetes, and so on. So it is very important to do screening so that we can take early prevention control measures, and that advanced disease intervention can be taken before it develops to morbidity and mortality. So screening tests can be done either questionnaires, examination, lab tests, and X-rays. Screening tests can often also used as a diagnostic test. Some disease, the screening test can also used as a diagnostic test. Diagnosis involve confirmatory tests. Okay, what's the difference between screening and diagnostic tests? Okay, screening tests done on apparently healthy. Diagnostic those with indication of sick. That means they have symptoms and signs lah. Okay, screening tests applied to groups. Diagnostics are applied to single patient. Based on one criteria for screening tests, diagnosis is based on evaluation of many factors. Less expensive, more expensive, not a basis of treatment, used as a basis of treatment. Highly sensitive for screening tests, highly specific for diagnostic tests. The initiatives come from investigators or agency providing care. The initiatives come from patient. Means that when we are sick, we go to the clinic or hospital to take diagnosis test, so then we can know what disease we develop actually. But for the screening test, usually they will open for public. Okay, public will come, and sometimes they will go to the schools. Okay, such as for the screening test of what we call cervical cancer or breast cancer. They open up for those female about 40 years old, okay, to do the mammogram screening test to detect early stage of the breast cancer lah. Okay, and for colorectal cancer also, currently they open for older age group, okay, about 40 years old, 40 years of age, among male people, okay, to do a screening test, okay, before. Because for your information, such as in colorectal cancer, usually the symptoms and sign occur at the late stage of the cancer, means a stage or stage 4, and sometimes have metastasis to other organ, means that the cancer have gone to the other organs, and the prognosis is very bad. So that is very important to have a screening test, so that we can detect earlier in early stage, and then early treatment and prevention can be done. Okay, types of screening, we've got mass screening, screening of the whole population or subgroup, irrespective of particular risk individual, such as in screening of anemia in all pregnant mothers. High risk or selective screening, screening applied selectively to high risk group, such as diabetic mellitus among people who have strong family history of DM, and multi-phasic screening, the administration of multiple tests or procedures to detect a disease or to detect several pathological conditions during the same screening visit. Alright, so that is it, I think. Yeah, for our lecture today. Alright, non-communicable disease. Okay, for attendance in column, you can put this password to mark your attendance there. Any questions regarding non-communicable disease? I guess all of you can understand. It is actually a very straightforward lecture today. Okay, most of them you have to understand and memorize a little bit in some points. Okay, so any questions? Ada soalan tak berkenaan dengan NCD? Anyone? Okay, again for your information. Okay, apa dia soalan dia?
Saya nak tanya, NCD ni kalau penyakit yang daripada keturunan dikira NCD juga ke?
Yup, NCD keturunan pun kita katakan sebagai genetic factors lah. It's also NCD because communicable disease ni benda yang boleh transmit daripada, macam contohnya penyakit yang ada, kita panggil causative organism lah selalunya, such as macam apa nama dia, TB ke, tuberculosis, ini disebabkan oleh Mycobacterium tuberculosis, ataupun penyakit denggi, denggi disebabkan disebabkan virus penyakit Aedes, virus denggi, terbalik, penyakit Aedes, virus denggi, and then macam tu lah. But genetic factor is not a communicable disease lah. Alright. Okay, ada soalan lain tak?
Eczema tu pun NCD ke?
Eczema ni
Condition dia ke ataupun disease?
eczema ni satu penyakit kulit, skin disease. Okay, dia bukannya disease, dia adalah condition. Eczema merah-merah macam tu kan. But disease mungkin boleh disebabkan contohnya eczema disebabkan allergic. Okay, ataupun eczema disebabkan ada disebabkan penyakit-penyakit kulit yang lain lah. Dia adalah macam kita panggil symptoms and signs also lah, tapi dia bukannya disease. Okay, tapi usually dia topical treatment saja. Kita tak perlu lebih on detail on systematic treatment. Topical treatment maknanya local treatment, kita nak hilangkan symptoms and signs tu saja. Okay.
Okay, Pak. Thank you.
Alright. Okay, for your information, lepas ni saya tak akan bagi slide lecture. Alright. And then saya hanya bagi recorded lecture untuk macam hari ni lah. And then you will do revision on this video lah. Okay. Supaya saya nak awak buat nota awak sendiri, awak faham apa yang saya ajar. Bukannya hanya berdasarkan slide sahaja. Alright. Okay, I think that's all for today lecture. Thank you.